Today I'm going to be talking about the proper use of PPE and donning and doffing it, as well as what use each piece of equipment has to protect us as sonographers in the field. So first we have the gown, which is used to prevent soiling of clothes and protect your skin. We also have a mask, which does have a face shield attached to it. The mask is used to prevent mucous membranes from coming in contact with your nose or mouth, and the face shield is used to prevent mucous membranes from coming in contact with your eyes. Lastly, we have our gloves, which keep our hands from coming in contact with bodily fluids or blood and prevent any exposure. So first, when donning, the first thing we want to do is hand sanitize. You'll note that it is an alcohol-based hand sanitizer, which is more expected to be used, and this is more effective. So first, when donning our PPE, we will be putting on our gown. Which first ties around the neck. And as well along the side so that it is fully closed on the back, and we'll tie around the front. So we wanted to cover our whole body. Next is the connected mask and face shield. If these were separate, you would do the mask first. So the mask put on, and you want to make sure that it fits along the nose first, and then you will tie it around the top. And along the nape of the neck. Lastly, our gloves, which you want to make sure are rolled above the sleeve of the gown. And now you are ready to go and have access to a patient. When doffing our PPE, we begin first with the gloves, which should be turned inside out in one another to create a ball. And you want to avoid touching the outside. And then they should be thrown in the trash as they are not reusable. We then perform our hand hygiene. Next is our gown, which we do want to avoid touching the outside of. Roll that in a ball inside out. and dispose in the garbage as it's not reusable. We then perform hand hygiene again. Next, we would be removing our face shield or goggles, which would be done by the arms or the forehead. But seeing as ours is connected, we will remove the mask and face shield together. Begin at the neck. And do not touch the outside of the mask as it is contaminated. And this will also be thrown in the garbage as we will not be reusing it. Lastly, perform hand hygiene again. And as the alcohol-based hand sanitizer can dry out your hands over time, it's always great to use the AHS provided lotion to keep your hand integrity. Hand washing should happen if your hands are soiled with any particles or blood. Disposable paper towel should be used to dry your hands. And as well, you can use the AHS provided lotion to maintain your hand integrity.